Hi, my name is Melissa Blanco and I'll be discussing autism spectrum disorder. Autism spectrum disorder is a complex developmental disability. Signs and symptoms typically occur during early childhood and is a spectrum condition. The affects individuals differently and to varying degrees. Diagnosing an ASD takes 2 steps. Initially, a developmental screening, followed by a comprehensive diagnostic evaluation. Developmental screenings usually take place at 9 months, 18 months, and 24 or 30 months. However, additional screening might be required if a child is high risk for developmental issues due to preterm birth, low birth weight, and other reasons. In addition, the Autism Society recommends that all children be specifically screened for ASD during well-child doctor visits at 18 and 24 months. In the event a child appears with ASD signs and symptoms, this would warrant a comprehensive diagnostic evaluation, which would be performed by either a developmental pediatrician, a child neurologist, a child psychologist, and/or a child psychiatrist. Here are some signs to look for: a lack of or delay in speech, repetitive use of language and/or motor mannerisms, an example being hand flapping, little or no eye contact, lack of interest in peer relationships, lack of spontaneous or make-believe play, persistent fixation on parts of objects. Here's some statistic-related facts. 1 in every 59 children has been identified with ASD. Boys are 4 times more likely to be identified with ASD rather than girls. A higher percentage of white children were identified with autism compared to Black or Hispanic children. And ASD runs in families. If a family has a child with ASD, there is a 3% chance that a second child will also have the disorder. As of yet, there is no known cause for ASD. Therefore, there is no cure. However, individuals on the spectrum do go on to have a normal lifespan. Being that there is no cure, their treatment options are early intervention, behavior and communication approaches, dietary approaches, and medication, specifically to address focus-related issues or high energy levels. The reason I chose this subject is because I actually have 2 children with varying forms of autism. I have a 14-year-old son that has Asperger's, which is a high-functioning form of autism. He is super smart, but very socially deficient. And one of the reasons why he received a late diagnosis at the age of 12 was because he was so high functioning. He had such a evolved vocabulary, so we attributed all his issues to him having, in addition to ASD, him having ADHD. Now my 4-year-old, that's a little bit of a different story. He was ultimately diagnosed as being mild to moderate autistic with speech delays and fine motor skills delays. By the time he was 18 months, I kind of had an inkling that something wasn't right. He didn't really communicate as well as my other children. By the time he was 2, he should have had 30 words in his vocabulary. He had 3. So we started the screening process with him and ultimately confirmed the diagnosis. Now both of my children are in applied behavior analysis therapy, which really hones in on giving them intensive therapy, both one-on-one and group therapy. The point to that being is 1, to teach them coping skills, and 2, to bridge their social deficiencies so that they can go on to live the highest functioning lives that they can with the best quality of life. Now, there's so many different resources that you could utilize for this information. However, I did go ahead and stick to 3. I picked the Alpine Learning Group, cdc.gov, as well as autismsociety.org. Thank you.